If your hands are shaking, your steps are slowing, or your body feels stiff, is it just tiredness or could it be something more? Today we are diving into a condition that silently affects millions of lives across the globe, Parkinson's disease. Hello everyone and welcome to Med News India, your trusted space where we talk about health, healing and hope. I'm your host Dushant Magu, and today on the occasion of World Parkinson's Day, we are bringing you a very important and eye-opening conversation. Before we begin, if you enjoy content that makes health simple and understandable, make sure you hit the subscribe button and don't forget to tap the bell icon so you never miss an update. Joining us today is a highly esteemed neurologist, Dr. Jaslovleen Kaur Sidhu. Dr. Jaslovleen is the director of Parkinson and DBS Program at Paras Hospital in Panchkula. With extensive experience in managing Parkinson disease and other movement disorders, she is dedicated to enhancing patients' care through advanced treatment modalities. Welcome to Med News India.
Thank you so much, Mr. Magu. I think your MedSearch platform is a perfect platform not only to create awareness, but also to deal with all different kind of diseases and tell people how to reach out to doctors. Thank you so much for having me here today.
Thank you, doctor, for joining us. Let's start with the basics. Doctor, what exactly is Parkinson's disease? People often notice the symptoms, but many don't really understand the condition itself.
Mr. Magu, Parkinson's is a neurodegenerative disease, which means it's an aging process. As we age, we tend to lose a lot of brain cells which were producing a particular chemical called dopamine chemical. The dopamine chemical is responsible for the movements, for moods, for memory, for controlled smooth movements of the body. When this chemical is reduced with aging or with any other reason, the patient's movements are slow or uncontrolled or not coordinated enough, due to which they develop tremors, which can be hand tremors, jaw tremors or leg tremors. They can be very slow in doing everything. The moods are very low, and you can see that patients often have this masked faces, and patients have difficulty walking, maintaining balance. All these symptoms can be there in Parkinson's. But if we say Parkinson's is not only aging disease, we do see Parkinson's younger patients also, like from 30 years of age till 80. Anybody can develop Parkinson's disease.
Thank you, doctor, for giving the information. So, doctor, when someone starts shaking or finds it hard to walk, are those the first signs?
There are a lot of signs of Parkinson's actually. So shaking can be present in many other neurodegenerative diseases. It can be part of essential tremors, spinocerebellar ataxia, even Alzheimer's. But in Parkinson's, we call it exactly Parkinson's when we see all the symptoms like shaking also, slowness also, walking difficulty, loss of balance. When all these symptoms are combinedly seen in a patient, then we call it Parkinson's. So if you're looking at early signs, the early signs may be just mood changes, slowness in daily activities, which is often confused with normal aging. Because as the person ages after 60 years of age, we tend to think, they're just aging. He might be slow because of that. The slowness in walking or doing different stuff. We assume that patient is just aged. That's why they're not able to do work. So Parkinson's, if you have tremors or slowness or walking difficulty, those may be the subtle signs that you can notice and approach your doctor.
So, Doctor, World Parkinson Day is observed on 11th April. What is the significance of this day? Is it only about awareness?
So, World Parkinson's Day was basically planned on 11th April because James Parkinson's, who actually first time described Parkinson's disease, was born on this day. So, we saw over time that Parkinson's, which is the second most common neurodegenerative disease in the whole world, and at present, if we're talking, there must be more than 10 lakh people in India suffering from this, was not much talked about. People confuse it with aging, like I earlier said. So not only awareness, we need to let people know how to diagnose it early and reach their doctors. Also with the World Parkinson's Day, we get to connect with a lot of patients, support groups. There are not many support groups in India, but I think with this, by creating awareness, we can actually reach out to a lot many people and create more support groups.
So, doctor, would you be willing to share a patient story that might help our listeners connect to the issue on a human level?
Yes, I think recently I got to see a patient who was just 42 years old. and he had Parkinson's for last 8 years. He was an army personnel, and because of his Parkinson's, he left his job early. He took an early retirement. Because of his tremors, not able to walk independently, and mostly being dependent on his family, he also started, being alone and not socially interacting much. And when I saw him 6 months back, he was in a very bad state. I mean, not able to walk. Even his wife had to help him in bathing and changing clothes. And imagine, Mr. Magu, just a 42-year-old person, sitting at home, not doing anything, which also causes a lot of depression because you're not interacting with the outside world. So when I saw him, he just mainly needed some modification of medicines. Also, over the last 6 months, we modified his medicines and then advised him deep brain stimulation surgery. And to my surprise, he responded wonderfully to it. Now, he's a person from a village, who is involved in farming, who was involved in farming and daily stuff. So to my surprise, after a month of DBS surgery, he sent me a beautiful video of working in the farms. And that was a moment of joy for me, when you see a life-changing procedure can do so much to somebody. He's not only interacting now, he's going to Gurdwara Sahib regularly and interacting with other people. So yeah, I have a lot of stories, but I think this one touched my heart the most.
Thank you so much, doctor, for sharing this wonderful story. And a common question, I think you have already answered it. Can Parkinson be cured?
So like I earlier said, Parkinson's is an aging disease. The chemical keeps on reducing in the brain as we age. And as we know, there's so many other aging diseases like osteoarthritis knee, heart diseases. We cannot cure them, but of course we can manage them. Aging cannot be reversed, and so Parkinson's can also not be reversed. But with a lot of medications, like there's dopamine deficiency in the brain. So if we give dopamine from outside, manage it accordingly as per the patient needs, we can do much more for the patient, just not by improving his movements, but also improving his moods. Dopamine is a reward chemical, it gives you happiness, it gives you movements, smooth movements. So I feel that many people are not aware of this fact that Parkinson's can be managed beautifully with medications, and if required, deep brain stimulation surgery done at a good time can also reverse a lot of the features of Parkinson's.
So doctor, is there anything we can do to reduce the risk of getting Parkinson?
Definitely. So dopamine chemical is usually said to be released in the brain naturally with a lot of activities like mental and physical activity. Importantly, physical activity, when you're exercising, you're engaged in creative activities, For example, in our day-to-day activity, we don't put much notice to our hobbies. We don't like doing much of it. But when you put efforts into learning a new activity or doing daily stuff engaging in brain games, it really helps a lot. At the same time, if you eat nice, if you eat clean and not overdo eating or are not sedentary, it really helps. So keep exercising, mental activity, and keep your diet clean.
So doctor, can you also give us insight about deep brain stimulation and how does it work?
So deep brain stimulation surgery is like a pacemaker surgery for the brain. We put 2 electrodes or wires in the brain and connect it with a battery which is placed inside the chest. And this mainly gives some electrical signals in the brain. So the area which controls Parkinson's movements, like the dopamine release, is basically given electrical signals through which we can actually control the movements, the tremors, the walking. So DBS works wonderfully for those patients who have had Parkinson's disease for the last 6, 7 or 10 years, and now the medication is not working very good. It kind of reverses their Parkinson's for a few years because the medication requirement is also reduced with DBS. Many people have this myth, that DBS should be kept at the last resort or at the last stage. But I should mention here that DBS surgeries need to be done at a good time, when you're doing well, not when you're completely dependent on others or you're not able to do much of activities. So my message to all the people out here is that Parkinson's is not to be something scared. It's a disease which can be very well managed with medications. But it's very important to optimize your medications because every age has its own medications. Levodopa, dopamine agonists, they need to be optimized as per the age. And once you reach a stage for DBS, you must consult a Parkinson's expert. So screen yourself. Thank you so much.
So, Doctor, thank you so much for your time and for breaking down this complex topic in such a clear and compassionate way. To all our listeners and viewers, if you or someone you know is showing any early signs, please don't delay. Consult a neurologist. The earlier it is diagnosed, the better it can be managed. And if you found this conversation valuable, please like, share and subscribe to Med News India for more medical insights, awareness, episodes and expert interviews. We'll see you next time with another episode that brings you closer to better health. Until then, stay aware, stay healthy.